1 out of 8 women will be diagnosed with breast cancer every year.
One in 1,000 men will be diagnosed with breast cancer each year.
Although breast cancer is not 100% preventable, there are some precautions that can be taken. Birth control pills,
obesity,
excessive alcohol use,
older age,
family history,
high estrogen levels,
relaxifene used for osteoporosis,
smoking,
and exposure to radiation can all put you at a greater risk for breast cancer.
Women should begin self-examination as early as 20 years of age, especially if it is in your family history.
For women, the best time to self-examine is during ovulation, which for most women is 1 week after your last menstrual cycle. Begin by looking at your breasts in the mirror with your shoulders straight and your arms on your hips. Here's what you should look for. Breasts that are their usual size, shape, and color. Breasts that are evenly shaped without visible distortion or swelling. Now raise your arms and look for the same changes. If you see any of the following changes, bring them to your doctor's attention. Dimpling, puckering, or bulging of the skin. A nipple that has changed position or an inverted nipple, pushed inward instead of sticking out. Redness, soreness, rash, or swelling. While you're at the mirror, look for any signs of fluid coming out of one or both nipples. This could be watery, milky, or yellow fluid or blood. Next, feel your breast while lying down, using your right hand to feel your left breast and then your left hand to feel your right breast. Cover the entire breast from top to bottom, side to side, from your collarbone to the top of your abdomen, and from your armpit to your cleavage. Follow a pattern to be sure that you cover the whole breast. You can begin at the nipple, moving in larger and larger circles until you reach the outer edge of the breast. You can also move your fingers up and down vertically in rows, as if you were mowing a lawn. This up and down approach seems to work best for most women. Be sure to feel all the tissue from the front to the back of your breast, for the skin and tissue just beneath. Use light pressure. Use medium pressure for tissue in the middle of your breast. Use firm pressure for the deep tissue in the back. When you've reached the deep tissue, you should be able to feel down to your rib cage. Finally, feel your breasts while you are standing or sitting. Many women find that the easiest way to feel their breasts is when their skin is wet and slippery, so they like to do this step in the shower. Cover your entire breast using the same hand movements described in step 4.
Men who are at high risk for breast cancer can benefit from doing a male breast self-exam. Male breast self-examination is to be performed each month. Knowing your overall health and what your breasts normally feel like is the best way to keep an eye on your breast health. To do this, you can do it the same way as stated in this previous video and the demonstration of how to do it. In order to do all you can for the prevention of breast cancer, you should drink in moderation, avoid unnecessary x-rays, try to have children before the age of 35, avoid mammograms before the age of 40, exercise, and you need to relax.
Although we have provided several ways to prevent breast cancer as much as possible, there are still over 200,000 new cases of breast cancer every year. Here are some links to ways that you can donate for a cure.
Here are also some links for ways to get involved at CMU. We have to stick together.